The territory that became Colorado was once known as the land of the Blue Sky people. The Native Americans of Colorado, who included the Ute, Cheyenne, Arapaho, Kiowa, Comanche, and Pawnee, lived in harmony with nature. Because of their sparse distribution in small communities scattered across the land and conservative way of life, their culture was their public health protection. In the early 1800s, news of the explorations by Lieutenant Zebulon Pike and Major Stephen Long were reported in the East. This brought trappers and traders to Colorado in search of valuable furs. The first real migration of settlers to Colorado consisted of ranchers and farmers in the mid-1800s. Wagon trains traveled the westward routes to California, Oregon, and New Mexico, with many main and secondary trails passing through Colorado. These often proved to be perilous journeys with high mortality rates for the travelers. Epidemics of diseases such as tuberculosis, measles, and smallpox, as well as injuries and accidents accounted for many of these deaths. Some have estimated that there were 10 graves per mile on the main trails. One of the deadliest diseases to strike the travelers in the wagon trains during that time was cholera. In 1849, an outbreak of cholera occurred in Julesburg, a significant stopover site situated at the crossroads of several trails in the northeast corner of Colorado. Passengers from the wagon trains shared contaminated water, leaving many sick and dead. Despite the risks, people continued to go west. Soon, joining the miners, merchants, ranchers, and farmers was another group known as health seekers. These people were lured to Colorado in the belief that the dry climate, mineral springs, bright sunshine, and high, cool mountain air would cure tuberculosis, asthma, and a variety of other illnesses. From 1870 through 1880, the territory's population increased fivefold, from nearly 40,000 people to 195,000 people. And Colorado was being called the World Sanatorium. It was estimated that 1/3 of the new residents had migrated to Colorado to seek health for themselves or their families. Some citizens complained that Colorado was becoming overpopulated with people infected by contagious diseases. But the erroneous belief in the healing powers of the climate and mineral waters remained popular. Then a discovery was made that would change the course of history in Colorado: gold. Pikes Peak or bust became the rallying call of the 59ers, and the rush for riches was on. Camps and towns seemed to appear overnight. Many of these settlements were built along rivers and streams with little concern for sanitation. The rapid growth in population resulted in waterborne diseases such as cholera and typhoid fever. While communicable health concerns were growing, a new kind of health problem was emerging: environmental pollution stemming from the burgeoning mining industries. Using all forms of mining techniques, miners seeking gold, silver, lead, and zinc worked Colorado's mountains extensively. Waste produced by mining introduced a new threat to public health and the environment. Land around the mining areas was destroyed by erosion, and the nearby water sources were polluted by acid mine drainage. The full extent of these impacts would not be realized for more than a century. In 1876, Colorado was granted statehood. Denver was beginning to prosper, but not without some growing public health concerns. Dr. Frederick J. Bancroft, president of the Territorial Board of Health, called Denver the dirtiest city in the United States. He was among a growing number of physicians calling for Denver city officials to provide sewers, odor abatement, alley cleaning, and the regulation of domestic animals. In 1877, the newly established State Board of Health was charged with recording the causes of illness and death, controlling epidemics, and providing advice on proper sources of water and places for sewage disposal. Despite the growing awareness of public health issues, epidemics continued to take their toll on Coloradans. In southern Colorado in 1877, a smallpox epidemic broke out, causing a reported 844 deaths in 3 counties. 2 years later, an outbreak of typhoid in Denver made an estimated 1,200 people sick and resulted in 47 deaths. The State Board of Health blamed this outbreak on foul air, filth-sodden soil, and polluted water. Despite the passage of several laws to control communicable diseases, the board was not granted the power to enforce existing health laws. The dawn of the 20th century found a Colorado that was in transition. It became clear that to achieve community health, one had to look beyond the perspective of the individual. Public health problems needed to be dealt with and controlled from a community-based perspective. By 1900, Colorado's population had climbed to over 500,000, and the rapid influx of people was causing growing pains. The boom days of the gold rush had, for the most part, gone bust, and the state was being industrialized. Mining and smelters were drawing new immigrants by the thousands, and the railroads eagerly helped transport them to this new land of opportunity. Farmers were starting to form co-ops, so that it was affordable to build dams and provide irrigation to the arid prairie. Amidst these changes, the perception of Colorado as the world sanatorium was declining. It was at about this time that tuberculosis was determined to be a communicable disease. The belief in the state's climate as a therapeutic remedy was giving way to more traditional forms of medical treatment. Epidemiological techniques to control the spread of disease included quarantines, immunization, and other new treatments. As a result, hospitals and sanatoriums began to dot the landscape throughout the state. Still, there was a general lack of public support for health issues at the turn of the century, and resources for public health were meager at best. Unless there was a disease outbreak, people were complacent about taking measures to protect public health. Water management and sewage disposal received only cursory attention from government officials in the business community. As the population of the state kept growing faster than the national rate, the problems with filth diseases only worsened. This especially affected children, resulting in infant mortality rates that were much higher than the national average. In 1901, the State Board of Health, with a staff of 2, issued its first complete mortality report, which listed the consumption, diphtheria, scarlet fever, pneumonia, and heart disease as some of the leading causes of death. Later, the board widened its scope of responsibility to include such functions as birth and death registrations, consumer protection programs, and public health nursing. Despite the efforts of the board at this time to prevent and control diseases, the Spanish flu still caused 7,000 deaths in Colorado. During the 1930s, the State Division of Public Health continued to grow, adding programs such as mother and child health and milk products control. In spite of making these gains, the division still lacked the resources to meet all the public health needs of Colorado's citizens. Then something happened in Colorado that was as significant to public health as the gold rush had been to the state's growth in population and economy. The year was 1944, and the governor of the state, John Vivian, appointed Dr. Florence Sabin to chair the subcommittee on health of the state's post-war planning committee. The subcommittee was charged with examining the condition of public health in the state. Dr. Sabin had recently moved back home to Colorado after a career as a distinguished scientist from the Rockefeller Institute. She not only brought with her a reputation as one of the world's leading researchers, but she was also the first woman professor at Johns Hopkins University and had been elected as the first female member of the National Academy of Sciences. While the governor was assured that this 73-year-old retired lady would not upset any apple carts, he would soon find that Dr. Sabin was not about to stay quietly in the background.
Yes, and then the governor was planning a post-war planning committee and incidentally put me on it. He didn't know anything about me, and it's rumored that he thought I was an old woman and no harm could come.
She immediately asked for a statewide health survey. The results of that study armed her with facts that ranked Colorado as one of the worst in the nation for deaths from preventable and controllable diseases. Dr. Sabin then spent the next several years barnstorming every county in Colorado to inform the citizens of the need for stricter health laws. She rallied the public, community leaders, and industry to persuade the Colorado legislature in 1947 to pass what are now known as the Sabin health laws. Not since statehood in 1876 had there been any major revisions of the state's public health regulations. Her efforts led to a new kind of modern public health in Colorado.
The legislators knew about it all over the state, and we kept a pretty careful watch, and it went through quickly. We had two bills, one to set up a good modern health department, and the other permissive legislation to allow our counties to organize their health. Those are two main bills, and they both went through.
To recognize Dr. Sabin for transforming one of the nation's most backward health codes into one of the most progressive, Coloradans chose her as the first distinguished citizen whose statue would represent this state in the U.S. Capitol in Washington, D.C. But it wasn't just in Colorado that a renaissance in public health was occurring. Food products were being more closely regulated, and government programs provided immunizations for diseases such as polio. Colorado's population jumped by nearly 33% during the decade of the 1950s. Public health issues intensified as people poured into the urban areas with additional demands on water supplies and sewage and waste disposal. Rural areas began to experience greater difficulty in providing basic health services and adequate medical facilities. In addition to the long-standing health issues, there were growing environmental concerns. It was not until the next decade, however, that the environmental movement would start to attract the public's attention and support. Nationally, the 1960s were a time of great social upheaval and the start of many people's personal involvement in environmental issues. In 1962, Rachel Carson published her revolutionary book, Silent Spring, which revealed the toxic effects of pollution and pesticides on the environment and galvanized the country into supporting new standards for the use of toxic substances. With this growing emphasis on the environment and the passing of public health legislation, Colorado health officials responded by turning their attention to pollution in the air, land, and water that resulted from population growth, industry waste, and negligence. At stake were the health and the beauty of the state. As a result, there was a real sense of urgency to start resolving some of these environmental issues. By 1963, an air monitoring network was set up, which today covers the majority of the state. In 1970, the Colorado Department of Health began taking environmental samplings around the Rocky Flats nuclear weapons plant, northwest of Denver, in order to find out if the air, water, and soil around the facility was contaminated with radioactive materials. A 9-year comprehensive study of the potential health effects from radioactive and chemical emissions was completed in 1999. In the mid-1970s, the State Health Department became aware of uranium mill tailings that were being used as fill materials for homes and businesses in various areas of western Colorado. State and federal funds were used to clean up many of these sites. More recently, medical monitoring programs have been established to track potential health problems from exposure to toxic metals, chemicals, and pesticides at 2 Denver area cleanup sites, the old Globeville plant and the Rocky Mountain Arsenal. To help with the elimination of filth diseases, sewage and waste disposal systems were upgraded so that by 1966, 97% of Colorado's population was being served by some form of secondary or complete treatment facility. The infant mortality death rate in 1967 was less than 1% above the national average, a vast improvement over the infant mortality death rates at the turn of the century. The federal, state, and local health officials continue to be called upon to respond to public health emergencies. These include the floods that inundated the Arkansas and Platte River valleys in 1965, and the Big Thompson flood in 1976. In 1997, E. coli 0157 was traced to hamburger processed at a Nebraska plant. This disease detective work led to the largest meat recall in the nation's history. Public health continues to be primarily involved in the collection and analysis of data to determine how to provide better public health services to the citizens of Colorado. For example, in 1987, Colorado became one of the first states to require reporting of HIV and AIDS by both care providers and laboratories with strict confidentiality standards. HIV surveillance data are analyzed to locate communities at risk, to identify gaps in prevention and medical services, and to evaluate the effectiveness of various disease control and prevention interventions. Through these activities, the state and local health officials in Colorado have turned the tide on the epidemic, and the number of new cases is dropping off significantly. These efforts, and others, cover a wide scope of health and environmental activities conducted by the Colorado Department of Public Health and Environment, local health agencies, and county nursing services. These activities range from issuing permits, assuring compliance with air and water pollution standards, and for the disposal of hazardous waste materials. Other activities also include disease control and prevention programs to reduce preventable death, disease, and injury. State and local health officials work to coordinate local emergency medical service systems, provide regulation of certain consumer products and services, and oversee the registration and issuing of Colorado's birth and death certificates. Also included is the licensing and certification of healthcare facilities and healthcare services for low-income individuals or children requiring specialized care. The public health approach in addressing health and environmental issues over the past 30 years has been to employ a trained, professional staff that is able to utilize advances in technology and to implement programs that are regulatory in nature. Good public health doesn't just happen. It affects everything we do, but it can easily be taken for granted. The future of public health will be shaped by all of us and the decisions we make. We must work together to assure that future generations will inherit a Colorado that is not only beautiful and clean, but continues to be a safe and healthy place to live.